So hello doctors, today we'll be talking about primary amenorrhea. Okay, so let's begin the class. So what is primary amenorrhea? So primary amenorrhea is failure to onset of menstruation. Beyond the age of 16 years. Actually it can be in two forms. One is beyond the age of 16 years with secondary sexual characteristics, or beyond the age of 14 years without secondary sexual characteristics with no previous history of menses. With no previous history of menses. And this is the definition of primary amenorrhea. So let's learn in detail about primary amenorrhea, cause it is given different in different books. So I'll give you a short explanation about what is primary amenorrhea and how to know what location it is from. So first of all, there are two things that you need to understand. That is, in female there is breast, there is uterus. So if the axis is intact and the uterus is intact, the HPO axis, it is defined by HPO axis. If the breast is intact and uterus is intact by USG, we see, then, or if it is breast is intact but uterus is not intact, not present, or if breast is not present and uterus is present. So these are the different possibilities that can happen. Now let's talk about examples of each. So if both are present, then it can be due to anorexia or weight loss. If pregnancy is present, or if she has imperforate hymen. So if both are present and still has amenorrhea, then these are the causes. If only breast is present and uterus is absent, then the causes are Mullerian agenesis, or androgen insensitivity syndrome, or testicular feminizing syndrome. So this is the causes, and if breast is present and uterus is absent, then the causes. And the cause is Kallmann syndrome. Or tumors in the pituitary, space occupying tumors. Like craniopharyngioma or Turner syndrome. So how will you diagnose this? So you will take red in red again. You will take here physical examination. Okay, again you can take history. For weight loss, we'll take physical examination, history, and then we can do UPT, urinary pregnancy test, for knowing if she's pregnant, or HCG levels. And for knowing this, we will take Mullerian agenesis, how will we know? So if it's Mullerian agenesis, she'll have double X chromosome and testosterone will be increased. If it is androgen insensitivity syndrome, then she'll have XY chromosome and testosterone will be increased. To differentiate between Mullerian agenesis and androgen insensitivity syndrome or testosterone feminizing syndrome. So again, if breast is present and breast is absent and uterus is present, then how will we know? So here you will take the levels of FSH and LH. So you can know how it is differentiated. And if you want to differentiate between if it's tumor or Kallmann syndrome, then you can do simply MRI. Okay. If it's Turner syndrome, the chromosome will be XO with increase in FSH and LH. So this is how you treat. And Kallmann syndrome specifically, we see one more thing, that is anosmia. Anosmia with amenorrhea, most probably it is Kallmann syndrome. So now we'll talk about the HPO axis. So HPO axis, hypothalamus, pituitary, ovaries. So hypothalamus releases GnRH. This pituitary releases FSH and LH. And estrogen and progesterone released by the ovaries. So here you'll have Kallmann syndrome. Here you'll have tumors like craniopharyngioma. And here you'll have Turner syndrome. So this is how we differentiate. Now we'll talk about how is the embryology. Okay, so here I forgot to mention here, after ovaries you can even write here about just one secondary sexual characteristics and endometrial folliculation. So if the problem is over here, will be absent secondary sexual characteristics and there won't be the proliferation of endometrium, resulting in amenorrhea. Now we'll talk about the embryology of female genital tract and understand where exactly the pathology lies. So embryology. So embryology, so normally it is XX. Okay, then it may be pathology may be in the Mullerian ducts. Or in the vulva, vagina or clitoris, or in the ovaries. So if Mullerian duct, what is the function of Mullerian duct? It helps in development of upper 1/3 of vagina, uterus and tubes, fallopian tubes. So if in this we have Mullerian inhibiting factor, then she'll have male characteristics. Okay, in this, if we have testosterone instead of normal progesterone estrogen, then she will develop testis in the inguinal canal, penis and scrotum. Okay, and if the ovaries are present, it is normally estrogen progesterone, which are responsible for secondary sexual characteristics. But in Turner syndrome, ovaries are affected. So she won't have secondary sexual characteristics. This is normal embryology. So now we'll understand what is Mullerian agenesis, what is its treatment and diagnosis. So, what is Mullerian agenesis? It is idiopathic loss of the ducts. Idiopathic loss of Mullerian ducts. Okay. Patient will have positive secondary sexual characteristics. Positive external genitalia, that is of female, but won't have uterus. And diagnosis is made by presence of XX chromosome with normal testosterone and normal FSH and LH. Treatment is vaginoplasty. Now we'll know what is androgen insensitivity syndrome. So androgen insensitivity syndrome. So pathology is resistance to testosterone. Resistance to testosterone and presence of X5 chromosome. Patient will have positive secondary sexual characteristics, positive female genitalia, external genitalia, and absence of uterus. So treatment is diagnosis is made by presence of XY chromosome and increased level of testosterone. And on USG we see testis. Treatment is elevation of vagina, that is vaginoplasty. After puberty we do orchidectomy after puberty to remove the testis. Now we'll talk about Turner syndrome. Turner syndrome, the pathology is the patient has streak ovaries. Okay, so the patient will be having other features like webbed neck, broad spaced nipple, shield like chest, and in heart pathology should be having coarctation. Absence of secondary sexual characteristics, but she'll have uterus, and her then her chromosomes will be XO type. There will be increased levels of FSH, LH. Ultrasound, we see streak ovaries. For treatment, we'll give her estrogen and progesterone combination, or only progesterone combination. Then we'll do echocardiography to see the pathology, for the pathology in the heart. And that's it for this class. Thank you.